Hello, my name is Alastair Lamb. I'm a prostate cancer surgeon at the Nuffield Department of Surgical Sciences. And we've produced this video for the Oxford Science and Ideas Festival to demonstrate some basic steps for beginners in how to tie surgical sutures and also how to close surgical wounds. What do you need for this? Well, to start with, all you need is one of your trainers, and then you need a banana and a few other bits and pieces which we'll go through in due course. So for this first section, as I said, all you need is one of your trainers, hopefully with some decent length laces. So let's get going with some knot tying. To do this, we need a trainer. This is my slightly wet trainer from this morning's run. And what we're doing with this is trying to simulate a wound and some suture that we're using to close the wound. Now it's important to decide which hand we're going to use to lay the knots on the tie. And this will be determined by whether we're right or left hand dominant. Now I'm right-handed, so I use my right hand to operate. So therefore it's my left hand that I'll be using to place the knots on the suture. The method we're going to be using here is the number 4 method, or actually in my case, as you'll see, it's the backwards 4. Now I'm going to place a couple of knots to start with, and then I will explain how I've done it. So with my left hand, I'm going to start with a backhand, and to do that, I'm going to hold the suture on the left between my forefinger and my thumb, and I'm going to use the rest of my fingers to fold the suture sideways like this. Then I'm going to lay the other bit of suture across the gap between the two and use that finger there to pull it through. And it goes up to the top side of the wound. So that's a backhand. We'll start again to demonstrate how that's done. Pen please. Thank you to my assistant. So a normal number 4 would be like this. But actually what you'll be seeing here is effectively it's a backwards 4, like this. And hopefully that'll become clear shortly. So let's do that again. So starting by placing, by lifting the right hand suture with my dominant hand, taking the left hand suture between forefinger and thumb, rotating my hand so that all the fingers are pushing the suture sideways. And then I'm laying across the middle there, creating that 4 shape 4. And then I'm using the middle finger to flip underneath, grabbing that suture between the middle and the ring finger on that side and pulling the suture through. So that is the backhand, the first of the knots being laid. Now I'm going to bring it down, and this time again using the left hand, I'm going to create again a backwards 4 by holding the suture between my thumb and my middle finger of the left hand, and using the index finger to push the suture out so that it creates a 4 like so. I'm then going to come under there, grab the suture between my index and ring fingers and pull it back across. Sorry, that should come down that way. So now we're starting with the knots already partially laid, which actually simplifies things a little because both sutures are now coming from the midline. So first of all, we'll do the backhand again. Holding the right hand part of the suture away with my dominant hand, I'm taking the suture between forefinger and thumb, rolling the hand so that everything comes across, creating the backwards 4, and then taking the loose end of the suture between my middle finger and my ring finger, pulling that through and snugging it tight. That's the backhand. For the forehand, I'm going to take the suture between my thumb and my middle finger, use my index finger again to create a backwards 4, to push the suture out. That goes underneath, flips the loose end of the suture through the gap, grabs it between my index finger and my middle finger and snugs it down. Of course, sometimes it's useful to see these things from a different angle, so now my trusty 11-year-old assistant is going to move around a little as I tie. So again, starting with the backhand. So the left hand takes the left hand suture between thumb and forefinger and uses the rest of the hand to rotate and push the suture off to one side. The right hand then creates the backwards number 4, and between the middle finger and ring finger, my left hand pulls the loose end of the knot through. Now a forehand. So this time I am holding the suture between my thumb and my middle finger and using my index finger to create the backwards 4 over the suture which I'm holding in my right hand. This index finger then runs underneath, grabs the loose end of the suture between index finger and middle finger and pulls it back through, laying a nice square knot. Now another important element of knot tying is to create square throws. This is in order to create a proper reef knot rather than a granny knot. So I'll show you again one of the key steps to make sure that the knots are square. So first of all, starting with the backhand, again, suture between the thumb and the index finger, hand rolled, and all the fingers being used to push the suture to one side. Laying the right hand part of the suture with my right hand down in the middle to create the backwards 4, grabbing the loose end between middle finger and ring finger, and you see here to lay a square knot, I'm making sure that I pull this upwards, so the left hand is high and the right hand is low. That's for the backhand. Now for the forehand, holding the suture between thumb and middle finger, using the index finger to push the suture across to create the backwards 4, passing underneath, grabbing the loose end of the suture between the index finger and middle finger, and this time, again to create the square knot, pulling it down to make sure that it's a proper reef knot and doesn't slip. So there we have it. I've placed, I think, 6 throws onto that knot, which would be plenty, normally with vicryl suture, which is the type that would be similar to the shoelace, which is a little bit stretchy. 3 knots would be sufficient.
Thank you for joining us for part 1 of our NDS video on tying surgical knots. Please do join us for part 2 on closing surgical wounds.